And so,
tell me about how it works, Alex.
Absolutely, thanks. And so I'll start off and talk about the storage requirements and the preparation, and then I'll hand it over to Brian. As you've probably heard, there's been stringent requirements for the ultra low temperature, and we received the package yesterday to shipment. And throughout the week, last week, we've been working with our facilities here to prepare the freezer that would store the vaccine.
Did you have a ultra low freezer already on site here at the Civic?
Yes, we already had that. And so we were really preparing for more of the surrounding, making sure that the monitoring was there, that the security was there. And so the team has really pulled together, and we've had that prepped. And so that was received yesterday, and today in preparation for the clinic. There's certain steps that are very much laid out by the manufacturer, where we thaw it first, and then we dilute it, and then we prepare the syringes for the vaccinator serum clinic. And so those are basically the high-level steps that we've taken.
And the syringes and that equipment, the federal government provided all of that, right?
That's right.
You paid for it, so I need to make sure you're not having to use your own stuff.
Yes, and everything came in time, so thank you for that.
That's wonderful.
Yeah.
That's great. That's good. And you felt prepared when it came.
Yes.
Excellent.
Yes.
Well, this is a great hospital. This is where I was born, so I'm happy.
wow.
Yes, indeed. So
Like coming home for you.
it is a good day to be back. Just a few days before my birthday. 49 years ago next week. Yeah.
Happy birthday.
Yeah.
Thank you guys. Well, this is the hospital. So anyway, Brian, tell me about how the operations are going.
Yeah, operationally, it's been so encouraging to see so many people from our community come together and pull together to make this happen when we really needed it.
Yeah.
The Ottawa Hospital has worked with Ottawa Public Health, our city partners, ministry partners as well, on so many different levels, working long hours, late evenings, early mornings to make this come together as soon as possible. So operationally, you'll see there's 5 different kind of steps or checkpoints for our clinic. First, our clients are greeted and screened to make sure that they're safe to come in. Then they proceed to our front desk to get registered and checked in so that our team knows that they're here and that they're in our computer system. And then they come into this room, the moment of truth, where they actually get the vaccine. We've got an excellent team of skilled nurses and physicians and other healthcare providers who can give the vaccine. And then our clients will proceed to a recovery room, and they'll be monitored for 15 minutes to make sure that everything's okay and that they're safe to go home. And then we just, the 5th step is to check them out, give them information and contact, and then that's pretty much it. Oh, and to remind them to come back in 3 weeks too.
That's right.
Yeah.
So the list of people who are getting the vaccines, was that established by Ottawa Public Health or by the province? How has that been organized here?
Yeah. So there's provincial direction to start with our long-term care facility partners, given the risks associated with those areas, and then our partners again on Ottawa Public Health did a fantastic job with booking all those spots, reconciling the lists, and getting everything ready so that our client lists were set to go. So, like I said, an incredible collaboration to make this happen today.
And in the 15-minute monitoring period afterwards, it's normal that people have a slight reaction because you're giving them a vaccine that's triggering their system to be able to react. But the reactions have been good, and people have been fine about that.
Absolutely, and we see that with the flu vaccine as well.
No,
it's quite normal, and so the same thing applies here. And actually, for this clinic, we've got a full team of physicians and nurses on standby just in case. But you're right, for the most part, it's not an issue. But just in case, we are ready for that.
It's important.
Yep.
And Venus, tell me about your approach here.
I just feel great enthusiasm by being a part of the solution to this ongoing pandemic that we have. And here at the Ottawa Hospital, definitely we were inspired by research and we were driven by compassion. And this day is a remarkable one, and it's part of history, I would say. And what we are witnessing now is just a major breakthrough in science and technology.
Well, I remember we were worried 6-10 months ago that it might take a really long time to develop a vaccine. And obviously, it's 10 months is long when you're in the middle of a pandemic, but the fact that we've got it and the fact that there are so many different vaccine makers using different approaches that are very, very promising gives us a good optimism for obviously being able to cover Canadians because we have so many different potential vaccines and so many potential doses, but also on our path to vaccinating 7 billion people around the world, we're going to need different options. So is this a vaccine there, or those used vials?
Those are empty vials.
Those are empty vials. Okay, so I can't touch these.
And you
I can touch this and run. No, there's no more. There we are. They are empty.
That's really cool.
Look at this.
Is that the normal size of a bottle of like that immunization? Or
Yeah, usually the
something like that?
multi-dose are usually generally that size, and they
Yeah.
usually have about 5 to 10 doses.
And these would be 5 doses?
5 doses per vial.
Now, you said you dilute it, though. Do you dilute it into here?
That's
or?
right. Yeah. So it comes as a frozen concentrate.
Yeah.
We add a small amount to dilute it, and then it's ready to use. We
Okay.
draw them up. We do them up in pharmacy.
Yeah.
Were the instructions really clear? From
Always very clear.
Very precise.
We've been in conversation with Pfizer, and they've been, no, you got to do it exactly this way, exactly that way.
They were very precise about
Yes.
everything, which is great, right?
Well,
And that's where last week you did a full run through, just practicing, with the empty vials
That's right.
and just doing all the steps every way, and that has given everyone a lot of confidence. Us, the company, but mostly patients who come through will know that you're ready for this.
absolutely.
Well, great work.
Thank you.
So it must feel really good to be
Yes.
doing this for the community. Like there's a certain heartwarming component to this that I can't actually get over in
Yeah.
the last couple days.
Yeah.
Yeah, it is emotional. It's
Yeah, it
the
is
beginning
emotional.
of the end. I mean,
Yeah.
it'll still be a long winter, and
This will be hard.
but as we start seeing the proportion of the population increase that has vaccines, we're going to be able to start thinking about what measures we can loosen a bit or do. But before we get there, we got to get through the winter. But we're going to do it together.
The season of hope.
That's
It's
it.
the season of hope.
Indeed.
It's ironic that it's at Christmas time. Yeah.
That's very good.
Well, thank you for everything that you're doing for the community. And I know not just this, I know that all healthcare workers have been working flat out for months and months and in very difficult circumstances. And we're so grateful to the work that you're doing. We know that it's been endless and, many sleepless nights and exhaustion. So thank you so much.
Thanks for coming today.
Yeah,
Appreciate
thank
it.
you. Thank you for your support.
Just great to be here. Thank you so much.
Yeah.
Can I give you an elbow, Venus? Thank you.
Absolutely. Yeah.
What a real pleasure. No, this is great to be here. It really is exciting.
Yeah, it's good to meet you.
Thank you. Thank you so much.
Good morning.
How you doing?
I'm good.
What's your name?
Jonathan.
Good to see you. What's your name? Julian. Pleasure to see you guys.
Have you had your immunization yet?
I am done.
You're done now.
You're done.
Yeah.
You've done the vaccine.
Happy.
Oh, I
does it
bet you're
feel?
happy.
So
Yeah,
tell me about
happy
your
now.
family at home.
Oh, we work as a PSW, my wife.
Uh-huh.
We're happy now because great.
Yeah,
Finally.
no, that's
Yeah,
Wonderful.
I have no
I feel
fear
much
to
safer.
work
You'll
at
feel
the,
safer. Yeah.
exactly. You
Yeah.
work and come home and not worry.
Yeah,
I know.
not
Listen.
worried anymore.
Well, thank you
Thank
for
you very
everything
much.
you're doing as a PSW.
Thank you for your effort too.
Listen, this woman did
Wow.
so much work to get to this point and
Yeah.
and through it. We're really, really
It's been a
lucky.
good team.
It has been a great team.
It's
Yeah.
been very hard for everyone, the
Yeah.
entire world and for Canada. But you know what? I am so proud of this country and the work that everyone together, from PSWs to politicians to hospital administrators, we've all worked to protect people. So
Yeah,
congratulations.
Thank
for
you
your
so
hard
much.
work.
Thank you so much.
What's your name? Julian.
Hi, I'm Joanne.
Oh, pleasure to meet you guys. Did you get your vaccine as well?
Got it. Oh,
How
yay.
do you feel?
So far, so good.
Excellent. Well, you're supposed to react a little bit because that means it's working. But that's great. Well, listen, what a pleasure to see you.
Yeah, nice to meet you.
Thank you for all your hard work as well.
Thank you.
It was great.